Good morning, everyone. I'm Jessie with Kentucky Youth Advocates, and welcome to this Wednesday's forum, our weekly Wednesday forum. This one is around families, children, and young adults in foster care. So those of you who were on last week's forum know that this is kind of a continuation of the conversation around how COVID has impacted child welfare and child welfare systems in Kentucky. And this is surely not the end of the conversation, but we're continuing that topic. May is National Foster Care Month and National Mental Health Month, so that makes this conversation even more appropriate. So as I mentioned, this is, I think, our largest forum to date in terms of attendees. So thank you to all of you for joining us, and thank you to all of you who submitted questions. We got a lot of questions, and many of those are going to be addressed in the panel discussion. Not all of them will be, and you're welcome to add your questions in the chat, and if we get a chance, we can address those, or panelists, if you're not talking and you want to address some questions in the chat, feel free to do so. So the chat function is set so everybody can see it. All of your Zoom audio are muted. And we are recording today. So before we really get started with the meat of this forum, we are going to try something that we've not done on one of these forums before, which is a poll. So I've never done this. So we're going to do a quick poll. If everybody can just take a second and fill this out, and we're just going to take a minute, and then I'm going to turn it over to Terry after a minute, and then Shannon is going to talk to you about the results of the poll after Terry's remarks. So let's see. Okay, I think somebody else who is logged in as KY Youth needs to launch that poll, maybe? We're going to give like 15 more seconds, and then we're going to try it. Okay. All right, poll is up. Is that what I hear? Are we polling? Is that a yes? Is the poll working? I can't see it on mine. Yes, good. Okay, so we're going to give it like a minute. Okay, Terry, I'm going to kick it over to you to welcome everybody.
Great. Well, as always, we really appreciate everybody joining us. Internally, we just read an article about Zoom fatigue, and I don't know if anybody else is experiencing that, but talked about how Zoom technology really mandated a different approach to presence, and I think we all feel that. So not only do I appreciate you taking time to be here, I appreciate you battling Zoom fatigue. As a reminder to everyone, our purpose in these Wednesday calls is to continue to focus upon kids and families in the midst of COVID-19. You also know our hypothesis is that we want leaders from every sector on every call, because we think that, for instance, today's topic of child welfare goes so far beyond just traditional child welfare folks. So we love seeing early childhood and juvenile justice and K-12 and economic security people on. I do want to give you a preview. Next week, we have a solo guest. Lieutenant Governor Coleman will be joining us, and our arenas of emphasis will be K-12, early childhood, and getting parents and families back to work. How's that creative tension of returning to work and taking care of kids? So we'll be spending the entire hour with her. And then on the 27th, we will be digging more deeply into the arena of K-12, both current status in the midst of COVID and especially looking ahead to the 2021 school year. So we'll have more info on that. I'm really, does not surprise me that we have such a large crowd today because child welfare cuts across so many sectors. I have to tell you, we did a podcast that dropped this week with Dale Suttles, who's joining us today, and Abby Drain, who runs Spiritus, Brooklawn and Bellwood residential facilities, as well as conversations with other child welfare leaders, as well as seeing some of the material that one of our guests, Grace Akers Place, is putting out in the middle of the COVID. And I don't know if there's any sector that has responded more creatively than child welfare. Kind of surprised me because I suspected, or I expected to hear lots of almost tragic situations in that sector. Instead, I really heard from leaders a lot of optimism. Internally, we at KYA are reviewing a really fascinating article from an author named Ann Chang, C-H-A-N-G. The title is Beyond Survival, 5 Keys to Unlock Social Innovation Among the COVID-19 Crises. And her number one tip is refocus the problem. Her premise is that you have to look at current situations and literally flip the equation on how to solve them. My sense is that child welfare as a sector has really embraced that idea. So I think you're going to hear today a message of imagination and optimism as opposed to woe is us. And I, for one, really appreciate that approach. So facilitating today is KYA's Czar of Child Welfare. So here is Czarina Shannon Moody, Miss Moody.
I feel like he's been saying that for so long, but I think there's a lot of people out of the loop on that one. My name is Shannon Moody. I've been with Kentucky Youth Advocates for a couple of years now and have focused on primarily child welfare related policy for the last couple of years. I'm really excited to facilitate this conversation today because we've got a lot of really great folks who are going to be providing some context. I'm going to share the poll results verbally because I can't share them with folks visually, but based on the results of the poll, it looked like folks are feeling kind of all over the map. It looked like we had at least, well, 1 out of every 2 people has forgotten what day it was at some point over the last 24 hours. Has felt frazzled, about 47% has felt frazzled. It looks like 16% of folks said something to their child or partner along the lines of, fine, watch whatever you want on TV and leave me alone. It looks like a majority of folks, 57% has felt anxious, 41% has given someone a hug, and 17% has had a deep conversation with, 17% has had a deep conversation with an animal, and I did answer yes to that one as well. A lot of, it looks like about 59% have questioned what to expect in the future. And I think that is, honestly, that almost feels low based on what you're kind of hearing within different sectors for different professionals. And I know that the folks that we have on who are going to be providing some insight on what they're dealing with are looking ahead, looking to the future, and I think trying to be really creative in the way that they are approaching things like Terry had talked about. So in the conversation today, we have Grace Akers, who is the CEO of St. Joe's Children's Home. She's been with St. Joe since 2014, but prior to that had a lengthy career with the Kentucky Cabinet for Health and Family Services. Dr. Austin Griffiths is an assistant professor of social work at WKU, and he is also the director of the Center for Child Welfare Education and Research, which is a new initiative that was recently launched, which is really exciting. He's been a frontline worker with DCBS and now focuses his research on child welfare practice and workforce development. Tia Humphrey is a junior at University of Louisville, Kent School of Social Work, so another social worker, and also a member of the Voices of the Commonwealth, and she is a foster care alum. And then we also have Dale Suttles, who is the president of Sunrise Children's Services, and he's been with that organization since 2012, but has experience that has spanned several years within the nonprofit world and serving youth. So we're really excited to have folks on, and we're going to jump right into the conversation. And we wanted this to be a little bit more conversational. So Grace, Dr. Griffiths, Dale, and Tia are going to be responding to the questions, you know, just kind of as they are feeling inspired to. And this question is to all of the members, and if you'd like to jump in or just watch the other participants, as far as how to respond or in what order, I can also call you out. But based on your current role, and please feel free to give a little bit of background on what that is to provide some more context, since I did that pretty simplistically. But based on your current role, what's your current take on how the foster care system and those working with families are struggling with the issues related to the pandemic right now? So how do you see folks struggling with the pandemic in this realm? But then also on the other side of that, what is giving you hope? So maybe talk a little bit about those struggles and what you're seeing in your world, but then also maybe some bright spots or silver linings.
This is Grace, and I can hop in. So St. Joe's has a group of foster families and foster children primarily focused on medically complex kids, and sibling groups has been our, I guess, field of expertise. So what we've done really is we've focused primarily on the adults. Of course, as you know, we're not doing face-to-face visits. So we've had to get creative with that. We actually have more touch points with families now and have increased virtual contact, do a lot of sidewalk drive-bys, a lot of, we're outside the house, they're inside, our foster families are inside the house. We did what we think is a pretty cool thing. We instituted a late night Zoom support group. Our support group by history has been rather structured when it comes to a subject or an activity. So we basically have a jam session with our foster families after kids go to bed. Our foster families, like all families, have felt the stress of being isolated and how to keep kids safe. We still are taking placements. We placed a medically complex child a couple of weeks ago, so how to do that safely. And they're struggling like we are in residential with school. So, you know, our tagline is #SupportYourTeachers, because we find that we are definitely not skilled at that, like most families and parents. So that's probably been the biggest challenge for us, has been school and just keeping kids active, sending our foster families activities and supports to do throughout the day and throughout the week. So I'll pass it to someone else.
So this is Dale Suttles, and good morning, everyone, and good to see everyone up and alert and so on. Well, we too have had to reinvent the wheel, so to speak, and the key for us is, and it's just like we're having the meeting today, it's find a way to communicate. Having to look at the way that you communicate and do that early on in this process. There was no blueprint. And so obviously communicating and supporting to let those foster parents know that we are here and we are listening, and we will find a way to get them the help that they need. Obviously using Skype and Zoom and all of those things, and having some of the same challenges with the educational piece, and making sure that our kids, we send pieces of and activities of things that these kids can use and keep active and feel connected and so on. Again, the group sessions to support foster parents and the open line of communication to talk about the challenges that they're going through has been very helpful and so on. We see a great deal of enthusiasm, and yes, people just like us, our foster parents are weary, but you also see a great deal of inspiration that they are reaching deep in their bag of tricks to stay connected with their foster kids and so on. So as Terry said early on, it's not been doom and gloom. There are challenges, but the key for us has been communication and education. Be honest with the kids. This is what we're going through. This is we're going to get there. There's light at the end of the tunnel, but we're all in this together. And communicating in a way to the teenager and to the 6-year-old that they can understand that we're going to get through this, and yes, we're all challenged, but we're a team, and I'm just excited about the potential and to see how our staff have reacted in a time of crisis. It's just really been really inspiring to see people come up and show their best at a time that their best is truly needed.
I know around the youth that I work with, they're kind of on the older side, so a lot of them are facing housing issues where they're having to leave their universities pretty early, considering they're closing down the dorms and everything. And as much as that is lacking their housing ways of doing it, it's also been teaching youth that they can reach out and advocate for themselves. I know a lot of youth have been taking matters into their own hands, considering a lot of the people they talk to are having to address and generalize a lot of the youth as a whole. So a lot of youth are taking matters into their own hands and really utilizing the resources that they can find, whether it's, talking to their social or caseworkers about going into independent living so that they have a home, or reaching out to old foster parents or friends and letting them know that, hey, they actually have some people in their corner, and that is very beneficial in this, where they know what relationships that they have. So after this, they continue those relationships and build and create stronger foundations in these relationships that really show them and illustrate that the way that they reached out and the way that they advocate for themselves, they can utilize that tactic further on into their life and benefit their life as much as they can.
It sounds like you're seeing a lot of resilience, Tia. What about you, Dr. Griffiths?
Yeah, it's first of all, I was going to say it's just great to be on here. It's awesome to see everybody getting together, and I really thank KYA for doing this. This speaks so much to y'all and for everybody to come together. Excellent stuff. Excellent stuff. So a couple of thoughts as a former CPS worker in Kentucky, which no doubt shaped my life personally and professionally. But when I think about COVID, and I'm like everybody else that's just personally and professionally impacted by this virus, as they say, that's probably the most commonly used word right now, unprecedented, right? This unprecedented time. No doubt, I think about two things here when we're talking about, the implications of the virus on foster families and kind of the influence of practice. I think about visitation, and I think about services. And so as a former worker, I know that not only anecdotally, but I also think about this heavy body of research. Actually wrote a textbook not too long ago, so I was able to get into the weeds and examine that body of research kind of ad nauseum, really. But the literature's clear, and I also know anecdotally, so it's good to kind of examine both of those. But nonetheless, it's just really clear that services matter, you know, when you're finding permanency for children in care that are experiencing that, you know, that life circumstance. And so with the virus and kind of the implications of the virus right now, you're talking about, I know here locally where I'm at, you know, a lot of folks aren't giving out maybe drug screens, or parenting classes aren't happening, or they're limited, or things like agencies are shifting to telehealth or telemedicine, which is great. But I'm very, you know, I don't know, privileged in that I have the internet and I have a phone, and I don't have the challenges of trying to find, I don't know, the internet or a phone or whatnot. So I'm just well aware that when we're talking about the average person that's in rural Kentucky or wherever they're at, you know, things like certain populations that have challenges related to socioeconomic status or demographic location or whatever, not everybody can just shift to telemedicine or telehealth. It's just not that easy. So we know that stuff, but I think about the implications on, you know, and I can talk about this stuff here after a little bit, but I've talked to some of our court personnel, you know, locally too. But, you know, thinking about services and the impact on services and delivery of services on the workforce and how that really matters and how it influences folks working with, you know, our foster children, our foster care system broadly. Specifically, we have a research project going on here in Warren County with WKU that I'm working with, and we try to kind of modify it and deliver it in a virtual capacity. It just didn't work. It just didn't work. It just wasn't that easy. Another thing about visitation that I wanted to say, and I think it's really exciting. Trust me, I'll get to some hopeful stuff here in a minute. But another thing about visitation that I'm excited about is that, you know, we can do these really exciting things about, you know, virtual stuff. But I also think about, you know, that might not be great for kids that are like real little. You think about toddlers, and you think about, you know, attachment and bonding, and, you know, John Bowlby and all these like empirical research about the littles, right? Some of us have had or experienced the babies and stuff, and, you know, the virtual phone calls when you can't have face-to-face contact, that person touch and contact and stuff. I mean, I think about it when I was a worker in the field, and you've got mom or dad or grandma or baby or whatever, and you've got that touch and that contact. My heart goes out to these families right now where there's this barrier right now when you've got that going on. So I think about that a lot, and I think about kind of, hopefully we'll be in a place soon where we can be better able to conduct those types of things, because, you know, that presents challenges. We know that presents challenges. Now, on the flip side, related to hope, because I'm a hopeful person and I'm excited that we're on this call, it is definitely, you know, Foster Care Awareness Month. I mean, this is May. This is exciting times. We're on this call doing these things. I do think that this is giving us an opportunity to really reconsider our why. I think individually and kind of collectively, I think that's important. I think for me as an individual, I've kind of forced myself to consider my why. Why do I do what I do? Why am I doing this? I think for all of us individually and collectively, why are we doing what we're doing? So this virus has really given me the opportunity to consider or reconsider my why. And I hope that individuals and agencies really take that kind of self-assessment, who they are, where they're going, and kind of what drives you. And, you know, I serve in the United States Air Force, so I really think that this is an opportunity to really adapt and overcome. And you've already heard from a couple of other people. So I've got my Air Force coin from when I earned my graduation from boot camp, and it talks about adapt and overcome. I don't know if they still do that, but it's really about adapt and overcome. And it's really great she was talking about resilience, and they were talking about Zoom support groups and all these innovative things that they're doing. And it's really about adapting and overcome. And I'm always encouraged by the things that they're doing. And there's just always examples of people that are just doing these wonderful, great things in spite of this, unprecedented time that really is a challenge that we're all facing together. But I'll quit talking. So I wanted to share some of those things that are on my heart. So.
Well, I heard a couple of themes, and I heard you all talk about one, the whole group talk about a utilization of technology and being able to provide some more access for some folks, but also the balance of like, there are still folks who are going to need to drive to McDonald's to get access to Wi-Fi because they don't have high-speed internet at their homes. And thinking about that balance and thinking about older youth in care and thinking about these families who need to stay connected through visitation or through other means, including foster families, you know, how have you all, or how has your staff maybe helped folks to understand what's going on and ensure that that access and connection to services is still happening even in spite of those you know, those limitations sometimes? What has your staff done, or what has Voices of the Commonwealth done to really engage people around that and get creative and problem solving when those barriers come up?
This is Grace. So early on, you know, we think back to mid-March, which is hard to believe. In some ways it seems like yesterday, in some ways it seems like 10 years. We had one goal, and it was, if we can keep our staff healthy, we can keep our kids healthy. How are we going to do that both emotionally and physical safety? And we wanted to make sure that we were connected both internally to our community, but also externally. So we used a lot of social media in the beginning to connect to our broader community. I think you all mentioned we did a behind the scenes with me, in part because so many of our staff are remote. So I'm one of the people who are still here. So we did a behind the scenes and connected our residential staff and our childcare staff and our operations staff, who have had such a huge hand in keeping physical safety here, to try to do that with our broader community, our support system, our donors. Our residential kids have taken to virtual meetings surprisingly well. One of the big nuggets, and I think you all will ask this question officially, but one of the big things that we've noticed is that virtual teaming has actually made for some rich teaming. We've had lots of meetings where we've had the caseworker from the cabinet, the GAL, teachers from the school system, the Wendy's worker, all on a virtual meeting with our residential child. They see their case moving in a way that maybe they didn't before the pandemic, in part because, you know, the cabinet on the public side has a little more time on their hands for their cases. They're not traveling. They're not spending 3 days in court. So those have been great nuggets and takeaways. The technology for our birth families is a big challenge, and it's probably the thing right now that we are worrying the most about is, you know, when can we start integrating family visitation? We have family visitation every Tuesday night here at St. Joe's with our residential kids. We have a little boy who was about to see his sister for the first time in 2 years before the pandemic. So those things are devastating to kids, and of course on the foster care side too. So the technology, especially for families that don't have enough, is going to remain a challenge, and that may be a lobbying point and an advocacy point for us as a community.
No, for VOC, before the pandemic, a really big part of being a part of this unit is making sure the foster youth are always connected to us. We always try and establish a really nice foundation with this foster youth in these relationships. And by doing this, we've been, you know, hosting conferences, in a way that provides them education on what they need to progress in their lives, but also providing a little fun and entertaining aspects to it, so they aren't just hit with all of this hard stuff and this real life stuff, but establishing in the relationships that we are here to provide information, but also to be a part of this youth and advocate relationship. And as a result of the pandemic, we've shifted our focus slightly for the advocates to understand what youth are going through, but also to help the advocates become more aware of what's happening around us. So I have been doing a whole bunch of webinars since the pandemic has started, and it has really improved my knowledge on a lot of child welfare aspects and how it affects youth on a daily basis. And as a result, we all figured that it would be beneficial for youth to be a part of this as well. So like Grace, we have initiated and kind of met the youth halfway with social media. And we've been hosting Zoom meetings every Friday for youth to be a part of, and to still give them that knowledge, whether it's been about independent living or mindfulness or understanding resources and where to go and who to ask for them. We're still establishing that connection and education through these Zoom meetings, but we're also still letting youth know that, hey, even though we are meeting remotely, we still have this connection and this relationship that we can still process and undergo all these challenges together. And we've also been doing Instagram lives where youth can participate, but also watch and learn about the youth and the advocates that they're being a part of and being put into with in this group. So I really feel like the VOC has definitely used this pandemic optimistically in that aspect, and understanding and letting the youth understand that when all of this is going down, our relationships haven't changed, our connections haven't changed. We have still been here whenever they need, whether it's someone to talk to or if they need to come to us with their issues or questions about resources, or even if it's just to have someone to talk to, because I know isolation is not ideal for anyone. So just having someone to talk to with that youth and advocate connection, I think has really been beneficial during this pandemic.
It sounds like some more connectivity in some ways, which is great. Dale, I know that you've got I think it's 5 residential facilities across the state.
Yes.
And thinking about the older youth, well, that just any of the youth in those facilities, are you seeing increased isolation? Are you seeing an increase in connectivity? What does this look like for you guys?
Well, we're seeing both, and first of all, let me go to something that Austin had said about rural, our clients in rural Eastern Kentucky and so on. We have programs in Moorhead and programs in Pikeville getting ready to open in Harlan, and connectivity is a real issue, having the proper equipment in these homes that really need the help. So in some cases, the first thing we had to do is we had to protect our workers. We had to give them the proper PPEs when they're going out to visit. We had to do all that stuff early on. And because we had to go old school, we still had to do visits. Now we did visits and we continue to do visits by social distancing. It has given us the opportunity to work with the child, work with the foster family to do some teachable moments. This is the new business. As of right now, we're going to have our meetings. We're going to stay apart, but we've had to go old school on this because of that connectivity. And I think somewhere down the road, if we're going to serve this hurting clientele that is definitely out there, we're going to have to go to legislators. We have to go to funders to say we could do so much more if we could have a situation where we could have this connectivity and these services could be readily available for everyone out there who needs that service. Shannon, as you were talking about our residential facilities, we're like everyone else. We had to kind of invent this wheel early on by, we had to isolate our children. We had to stop on-campus visits, volunteer opportunities, colleges that come. Even the way we serve our meals, we had to change. How do you social distance in a residential facility? And you see you see what's going on in some of the other industries, that if someone gets this virus, that it can just spread rapidly. So we have had to do a lot of teachable moments. We've had to clean. We've had to keep isolation. And why isolation? We've had to be very upfront about, this is what this is about. It will end at some point, and hang with us. We've had to include a lot of games, a lot of, when it's pretty, some outdoor activities at a social distancing. We've had to be extremely creative in how we do this. And our staff clean diligently every single day. One of the toughest things was, in our rule of thumb, is staff come to work, go to Kroger, and go home. Come to work, go to Kroger, and go home, because you can't simply do things the way that you used to do them. We are in charge of a herding clientele, and we don't want to bring this COVID virus in these close quarters. So our staff have adapted. It was a learning experience at first. And now there is some fatigue, but they're hanging in there, and it's been about being honest and having that open communication.
In thinking about the need for that kind of open communication, and also kind of what I'm hearing as far as practices within the agency. I assume that, within St. Joe's and within Sunrise, you all are having to be clear with your staff about what protocols have changed and what practices have changed. I'm wondering, for all of you all, the few positive practice and policy changes, either within the agency or even on the state level, that have been enacted during the pandemic, which ones are you hoping will stick around? What are you hoping will be kind of the new normal?
I love that question, Shannon. And our team got together earlier this week and looked at y'all's questions ahead of time. And so we have three. So one is related to our child care. We're a limited duration, and we have some CCAP families, and CCAP is a funding stream for families that meet an income threshold. So right now, that funding stream is much more flexible, and it's attached to enrollment and not attendance. So this is really, it's actually a much, much bigger discussion than St. Joe's, because there are child care centers that are going to struggle to open. And I know the governor and the goal at the cabinet is that we don't want to lose that footprint, especially for families, vulnerable families. So CCAP funding and flexible funding, we really, really are hoping that that's going to stick around, and we think that that's going to be critical for families, as there are a lot of families out there, and we know this, that are struggling with child care issues now. So that's one. Our late night Zoom, we're definitely going to keep that around. Our foster parents have loved it. It's been a really cool thing. Their kids go to bed and they hop on a call. And then the virtual teaming, especially with Cabinet and GAL, and that has been a great thing for our residential kids. They've taken to it and they feel connected to the team in a way that they haven't always seen.
I'm gonna have to agree with Grace here. With the VOC, we have these conferences that are typically monthly with foster youth. But as a result of the pandemic, we've been utilizing these Zoom meetings and getting to know our youth a lot deeper. So with that in mind, I think we're going to keep the Zoom meetings weekly, just so we can touch base with youth and they can tell us how their week has been and what's been going on in their lives, while also continuing the conferences, just so we still have that face-to-face interaction. But also this social media, getting to know our advocates a lot deeper and how they've come to be where they are, and the Instagram lives where we're interviewing people and understanding how our lives interact and compare with others, so we can know how to utilize that information and give that to youth and how youth will utilize that information. So I definitely agree with Grace on the Zoom meetings. We're building that connection a lot closer weekly with the Zoom meetings. So I definitely think youth are enjoying the Zoom meetings quite well, to the point where we're going to keep them weekly, but also have the conferences monthly to build on those relationships.
Well, and just to piggyback on that, be able to keep the contact from these social media sources. We've had some of our workers with our kids that some of our kids very withdrawn. We've asked them to act out their favorite movie scene with come on to the screen, and some of the things these kids have done has been hilarious, and it really just breaks down those barriers so that you can have a good conversation with them. But what we have seen is that kids appreciate these opportunities because it's their world, right? I mean, all we're kind of catching up to it, some of us, and but this is where they're comfortable, and so to keep some of those aspects of being able to help by using these tools. But the one thing I always want to talk about is that when you come out of something like this, and we don't know how long this is going to go on, certainly until we get a vaccine, but you have 20% unemployment. 20% unemployment, 20% of the people that are not paying taxes. So what gets cut? It's usually education, it's social services, those kinds of things. That can't happen, folks. That can't happen. I think we've got to be a strong advocate to stand up to, I call him Brother Brashear, and the folks in Frankfurt, because this has been a major hit, but it cannot be at the expense of Kentucky's most vulnerable kids, whether it be our colleges or whether it be social services or whatever. And I think all of us need to get out in front of that before those discussions even take place, because it's not right. This is our future. I could go all day about this, and I've seen it go on too long. And we need to put more money in some of these ventures and not less. So I think we need to have a strong voice moving forward as we come out of this this COVID craziness.
Dr. Griffiths, I don't want to put you on the spot, but I mean, based on the reflections from Dale and Grace and Tia, just kind of experiencing things on the ground, I'm wondering if for you on the research end of things, if you're seeing what the impact of the pandemic will have as you look forward and think about what to analyze, what to look at as a child welfare researcher?
Well, I mean, good question, right? I suppose our goal is definitely applied research, because we're committed to research that matters, that makes a difference. One thing I wanted to speak to, and this is definitely in line with any type of applied research, is kind of this idea of how might this influence permanency. So I wanted to just kind of speak to that for just a second. Spoke with a colleague, Judge Micah Pence here in Barron County the other day. I've known for a number of years. Y'all know her. Some of y'all know her. And I guess the short answer is, I would think that, and kind of speaking with her, this is definitely influencing permanency one way or another. I mean, the idea that court hearings are going to be either continued for a period of time or one way or another. I mean, if you have delays in court hearings, you have issues with accessibility or limitations with services. I mean, hopefully this is a concise, limited period of time. But right now, I mean, I'm not saying the court is completely shut down, but there are real implications with court proceedings right now. That's what's going on. So as I'd already mentioned, things like drug testing not occurring in certain areas, parenting classes, other services, et cetera, et cetera. One thing that's a very, very much a positive, which is encouraging, and we had just spoke about what are we doing to be proactive and keep some of the good from this virus. This is something cool I wanted to share, is they are making a way to kind of save court as they move forward here locally where I'm at for like action items and kind of contested steps, because as we move out of this virus, they're going to have to sanitize the whole courtroom like after every hearing, right? Whenever we get the off you go with the court stuff. So it's not going to be like they can manage or handle the volume that they could previously handle. So it's going to take time and resources and all of that. So they're not going to be able to cycle folks through. So what they're doing is, like you had said, and maybe they're doing this across the state, I don't know, but it's very proactive and really innovative, is using technology to bring folks together to communicate beforehand through Zoom and other platforms to kind of hash things out proactively long before they get to the courtroom to try to, I suppose, utilize vital and limited resources of the court personnel and otherwise before they get to the courtroom, especially knowing that this is kind of where we're going to be living, at least for the near future. So I do like the idea that court personnel are going to be taking proactive steps to do that, knowing that at least for the near future, there's going to be kind of a trajectory that's going to influence potentially the permanency of children. You know what I'm saying? If there is a consensus and people are in agreement, that's one thing. But even then, if definitely there are contested steps, action items, that's what they're going to try to save actual court hearings for. But nonetheless, like folks have been saying, you're going to be talking about sanitizing the whole courtroom. It's just going to be a major different enterprise. And again, it's different in every courtroom and throughout all of our counties in Kentucky. But that's something I wanted to mention, that these are just things we're going to work through, as we say, together. But it's worth mentioning. And the research that we're doing at WKU, and the thing is, it's great. We've got so many good universities here in this state and nationally as well, but especially I want to give a shout out across this state, because we've got great partners across this state. And people on this call, right, not to mention any names, but we're working together right now. So this is good stuff. You know, it's an us thing. And we're working together right now to do great stuff for Kentucky's families and children. So I'm excited about it. And reach out to me. You know what I'm saying? This is what we're doing right now. So anyway.
Well, I appreciate the thoughts, because you're right. I mean, there's a lot of implications. There's definitely implications for court. What I've been hearing, though, from Grace and just based on other calls, is that there's actually more people attending those Zoom hearings or those Skype hearings. I think they're utilizing Skype based on recommendations, depending on the courts because of privacy concerns. But there, you know, the GAL, the bio parent, everyone's able to get there, and sometimes that's not the case. So there may be some improved you know, communication within those virtual hearings. Austin, as you said, there's a lot of implications for permanency, and I'm wondering, I know youth aging out is a great concern right now, either turning 18 or turning 21. I know that the cabinet has communicated that they're kind of creating some internal policies to make sure that youth are not getting out of the system. But just thinking, Tia, about what you're hearing, what are some of the issues that VOC is dealing right now with the youth that you all work with?
A lot of the youth have been waiting so long to age out and utilize all of the programs and stuff that they're being offered. But with the pandemic going on, they're being encouraged to maybe extend their stay at their foster houses or kind of utilize different resources. But that's frustrating to youth considering they've been waiting so long for this independency and this responsibility to fall on their shoulders that they're not getting what they want. So a lot of VOC members are handling foster youth that are kind of being frustrated with the system right now and the pandemic. But we are struggling to help them understand that at the moment right now, it is best for them to either stay where they are or utilize programs that will get them into a home right away. A lot of programs currently right now are updating their policies to where they're not requiring so much for you to stay in the program, but that is for existing independent youth that are going through that right now. For youth that are transitioning, they're not able to acquire those resources and time to incorporate what they need for the program. So we're trying to help them understand that with getting into these programs, it takes time to, find the apartments and find the resources and get what they need inside these apartments before they can move in. And a lot of youth are not realizing that that takes a lot of time, and we don't want them to be in this position where they don't have a foster home, but their independent living homes aren't quite ready yet. So for those 18-year-old youths that are really wanting to get out there and be on their own, they're having trouble understanding with the pandemic going on is kind of slowing down a lot of the resources that are being given out to youth. So as a result, they're getting impatient and kind of losing faith in the programs that are being established. So we're trying to communicate to them the understanding that, we've all been there. We all want the independent life and to not have to be told what to do all the time and be able to live our life the way we want to. But with the pandemic going on, it is hindering their abilities to do that. And with youth that are kind of leaving States Care altogether at 21, we're trying to utilize their resources and get them to really understand the benefits that they have now so that they can save up and utilize those resources when maybe they're having scarce or not able to get a lot of resources that they need. So through the youth that are trying to transition out, we are also trying to relay that same theme and where they should stay where they are and utilize the benefits that they are acquiring from their programs now. So when they're, when the pandemic is kind of coming to an end, they'll be able to have the resources that they've kept and utilize that at that point, other than struggling all the way until the end and trying to utilize or acquire different resources and different benefits from different programs that are going to acquire a lot more of their attention and a lot more strength than to just have what they have now and advocate to stay where they are and have patience in what they have and not try and do so much at one time. I know youth all around are really focused at growing and getting to a different spot in their lives, but as a result of this pandemic, it's hindering that ability and kind of squandering what they want and their responsibilities and what they want in their lives to where it's pushing them to want to do more, but hindering them in the way that you are not able to do that. So all around, the advocates on the VOC are trying to illustrate to youth 18 to 21 that we're trying not to push them to, we don't want them to do what they don't want to do, but we're trying to advocate to them that we we've been in your position, whether it either we were transitioning or we were trying to get into programs like yourself, but you have to understand that what we're telling you is for your benefit, and the connection from our lives to theirs is grave, in that they have to really understand we've been in that position, and what we're telling them is going to help them now and in the future.
Yeah, Tia, I mean, you think you're doing a phenomenal job. You know, it sounds like what you all are trying to communicate with the older youth who are really looking forward to that independence and being able to do what they want. There's a lot of similarities with, you know, other folks. We're asking folks to be patient. We're asking folks to be mindful and planful, and in order to make sure that we are all in a better position when we come out of this. And so I heard from, I think, all of the folks that we are, this is an opportunity to identify some advocacy options, right? Like around whether it's youth transitioning out of care and making sure that they've got the resources that they need or the information that they need about the resources. We've got folks who have access to technology so that we can streamline some of those processes or include and be creative around connectivity. And then also just asking folks to, in this system, to have patience, which can be really hard when kids are in families are in such vulnerable situations. So Grace, Dale, Austin, Tia, we so appreciate everything that you all have done and the information that you've provided. I know we've got, I think, one last polling question for folks before we close. So Jesse, I don't know if you want to pull that up.
Yep, I'm going to pop that up. Can you guys see that? Anybody see that? No? No? Okay, so we are not going to do a poll. Instead, if everyone can use your reaction emoji and give me like a thumbs up or a nothing. Thumbs up if you are prepared to take some next steps with your legislator when it comes to the upcoming legislative session, and just give me nothing if you're like, I heard all that and I'm so blasé. Okay, thumbs up, thumbs up. Okay, that's a lot of thumbs up. That was a good poll. That was a good poll. We'll just do it that way from now on. So yeah, just to close us out, thank you all for joining us today. And you know, as we're navigating this new world, this much more virtual world, and we're not really sure what advocacy is even going to look like during the legislative session, and knowing, to Dale's point, that like the things that often get sacrificed first in the budget can be kids and families, especially kids and families who are facing some of the greatest challenges. We are really going to need all of you. Hold on a second, honey. We are really going to need all of you and everybody together. I know you're trying to tell me something, honey. Everybody on the call can hear you. That's my son. I'm so sorry, everybody. Okay, so we're going to keep these forums going. We're going to keep advocacy going. There may end up being like a Children's Advocacy Week instead of a Children's Advocacy Day, because we won't be able to get all in the Capitol all at the same time. So we'll just spread it out. I don't know. And we'll be doing some more virtual stuff too. So as Terry said earlier today, Lieutenant Governor / Secretary Coleman will be joining us next week. So we hope all of you will join us for next week's forum next Wednesday at 10 a.m. Eastern. And we'll send out a link to that in the follow-up to this forum. And thank you, everyone, for being here and making our Wednesdays feel like we're all moving forward together. Bye, everybody.